Hello, my name is Marie, and I want to welcome you to an interactive Learning Center teaching plan. We will be discussing how using the five senses enhance the ability to learn and increase retention when using simulation. This content is based on the book, Learner-Centered Teaching, Putting the Research on Learning into Practice by Terry Doyle. Additional references include Strauss, Multidisciplinary Simulation Centers, Promoting Safe Practice, and Zolkowski, Simulation Use in the Classroom, Impact on Knowledge Acquisition, Satisfaction, and Self-Confidence. I look forward to sharing this exciting method with you. We will begin with the objective of this presentation. The student's role in education is to learn, retain, and build upon previous knowledge. Using active learning strategies through learner-centered teaching allows students to assimilate knowledge through multiple methods: seeing, hearing, feeling, tasting, or smelling. When using simulation, students are able to use several senses to facilitate learning and recall of information. First, let's talk about the senses. When participants can taste, see, smell, hear, or touch when learning, using those additional senses help confirm the learning and enhance the ability to remember that fact. Think of when you ate your first dill pickle. Just thinking about that dill pickle brings to mind the taste, the smell, and the feel of the pickle, even though you are only thinking of it right now. These senses help you remember that experience, that fact. As we look to see how we can improve our students' learning, embracing simulation, a learner-centered teaching activity, is an active teaching strategy we can employ. Simulation is an excellent way to allow students to engage multiple senses in learning new skills. The senses help you to retain new knowledge. Studies show that when two or more senses are used, recall of information improves 20 to 50% over a single sense. Here you can see students practicing with a simulator. The senses included in this simulation are tactile. The student feels through her or his hands as they insert nasogastric tubes or airways into a mannequin. Auditory. They hear the sound of air as it enters the lungs. Or they hear the sound of air when the nasogastric tube is placed in the stomach and tested with a syringe. Additionally, they are able to see the lungs inflate on this simulator. Each of these senses helps reinforce the neural connection in their brains as they hardwire the new skill of airway insertion or nasogastric insertion. Then the student is able to transfer this knowledge to the patient. Nurses assess patients every day. During assessment, you visually inspect the patient, listen to the heart, lungs, and blood pressure, and you feel for pulses, using the senses. When using simulation mannequins, you can practice each of these skills in a non-threatening environment prior to caring for your first patient. I have had the opportunity to work with students in various simulation experiences. Students state they are more confident in their skills and have improved recall when working with actual patients. A definite confidence booster for students and patients. Another great feature of learner-centered teaching is developing critical thinking skills. Critical thinking skills are developed during simulation experiences by the nursing students. During assessment, the students are able to visually see, hear, and feel patient vital signs. In this high-fidelity simulation, the student also speaks with the patient, asking questions, and the patient complains of chest discomfort. The senses are involved in each of these steps. Students then analyze all of the data coming to them from the monitors, the patient, and the physical assessment to deliver appropriate treatment. This is definitely hands-on learning using a multisensory approach. Here, an emergency department resident and nursing students collaborate together to identify what health issues this patient, the high-fidelity simulator, has and the next steps to treat him. Through assessment skills and speaking with the patient, they are able to diagnose the chief complaint and then begin appropriate treatment. This active learning strategy has received high marks from both the nursing students and residents as they learn together in an emergency department simulation scenario. The implementation of auditory and visual learning is combined, integrating and organizing the information in this simulation. We now incorporate interdisciplinary simulation experiences into our curriculum. The simulation progresses as an unfolding case study. The doctor is sharing the laboratory results with the nurses. The nurses are executing the treatment plans, starting the IV, preparing injections, and preparing to insert a Foley catheter. Using the results from assessment and diagnostic tests, the diagnosis can be made for this patient. The nurses and doctors work side by side initiating care. In the simulation experiences I have led, the unfolding case study can deteriorate into a code situation if the students do not recognize and treat the symptoms as they present. This is a great learner-centered teaching method. Students have repeatedly stated in the simulation debriefings what a great experience this simulation was. They have been able to recall information about the simulation weeks and months later, showing the benefit of simulation as a learner-centered teaching method. They have been able to apply concepts to their patients in clinical settings. In conclusion, using the senses with simulation increases our ability to learn and recall. The tactile, visual, and auditory senses used in simulation are a multisensory approach to learning increasing mental constructs in the brain. When we know the answer, we are eager to share that knowledge with everyone. We want our students to be these learners, hoping to be called upon to answer the question. As nursing educators, we need to build learner-centered strategies into our courses to facilitate our students' learning. Simulation and the use of the senses has been shown to be a great learner-centered teaching strategy in nursing. I hope you consider adding this to your course in the very near future. Good luck to each of you as you begin to implement these concepts with your learner-centered classes. Thank you. Here are our references, and have a great day.